I must tell you that ISCCM, as far as professional societies go, is a relatively young society. The membership, of course, is growing. We have more than 7,000 members now, spread all over the country, around 70 branches or so. And it is very active in terms of its aims and objectives, namely education, in terms of providing training in intensive care and possible qualification, in terms of providing continuing medical education, and the third and very important aspect is in providing a platform for research. The first aspect about training and qualification has been handled by the ISCCM by creating a Indian College of Critical Care Medicine, which has now over 100 fellows as its members and has a proper structure in terms of a chancellor, a vice chancellor, governing council, to look into the various aspects of training in intensive care, developing competencies, developing a competency-based curriculum, promoting appropriate ways of assessment of candidates, both in training and at the end of their training. And this then leads to appropriate qualification. As far as continuing medical education goes, generally we have small group workshops, and then of course we have the main conference, which has scientific sessions, debates, and it may have things like, how would I do this? Promoting practice-based kind of questions. And then it may have small groups, especially in breakfast sessions, where you can meet the international faculty or the national faculty in small groups, and you can ask your queries hands-on. So these are the things that we are doing with regard to continuing medical education, and I hope CRITICARE 2015 reflects this. I have been very actively involved with CRITICARE 2015. The conference scientific chairperson, National Conference Scientific Chairperson, is the president of the society, and this has led to greater concordance between what the local organizing committee does and what the center of ISCCM wants to promote. And I hope that CRITICARE 2015 will reflect this concordance between the central leadership and the local organizing committee. And I'm fortunate to have worked with Dr. Sriram Sampath, who's the scientific chairperson from Bangalore, Dr. Pradeep Rangappa, who's the organizing secretary, and of course all his members. It would not be possible to mention all of them, but all of them have worked extremely hard. I have worked very closely with Dr. Sriram Sampath, who is also the chairperson of the research committee of ISCCM, in order to see what kind of platform we can provide for research for our members and for the ICUs that form part of our research network. So there are about 350 registered ICUs in our network. The platform that we are going to provide is a cloud-based database which will enable individual members, ICUs, to enter data from their ICUs on smartphones or on tablets or on their PCs, making it easier to enter data. And not only this, we will have training for people how to use the database. Then through this we will generate quality indicators which will enable individual ICUs to know how their ICUs are performing. They can compare their own performance with before, and they can even compare it with an Indian benchmark. Such a thing does not exist, at least in my knowledge, in any other specialty. And in time we hope that this base that we will prepare for research will encourage the development of new ideas and proposals for research which will be meaningful in our subcontinent context.